You're watching East Texas Live.
Hey, welcome back to East Texas Live. I'm your host, James, and joining us now is Cassandra Ford from the Beverly Clinic in Longview, and you're going to teach me a new terminology here, medication adherence. Is that exactly what it sounds like?
Yes. So chronic disease continue to increase in the world today, yet medication adherence has decreased, which results in poor clinical outcome. So according to the American Medical Association, some common side effects are fear of medication use or the lack of knowledge knowing how to use medications such as in injectables or inhalers. Cost of medication may be due to fixed income, a lack of resources. Some patients may say, I'm not experiencing any symptoms, so why should I take the medication? And lastly, lack of knowledge about the medication or the disease process.
Yeah, so my dad has an issue with this. You know, he feels fine. Why do I need to keep taking this medicine? I was feeling bad. I took the medicine. I feel better. I don't need it anymore. And I try and tell him, no, the medication is why you feel better. You need to keep taking it.
So, are you there?
Yeah, I hear you. Go ahead.
Yes. Okay. So here at the Beverly Clinic, we strive to be partners in health. We ensure that patients understand the importance of taking medication, the risks from deviating from medications, knowledge about their disease, and how to respond to undesirable side effects. We also offer follow-up visits to monitor outcomes to decrease complications with the medications.
So what's the Beverly Clinic doing now to help people improve their medication adherence, stick with those prescriptions?
So that's, like I said, we offer follow-up visits. After we prescribe new medications, we bring patients back in. We listen to their concerns about medication, whether it's a cost issue or whether maybe they don't like the side effects that they're experiencing. And we listen to the patients and ensure that at the end of their visits, they're satisfied with the care that we're offering to them.
So for those of us who have someone who we're not sure if they're up to date on their medication adherence, how do we push them into getting help, or at least revisiting, or maybe even having a chat with you about getting it together?
I did not hear you. I'm sorry.
That's okay. I was just asking, how do we peer pressure those around us who we're concerned if they have proper medication adherence? Because, you know, I don't have the lab coat on. I don't sound or look like a professional, but I would like to have someone talk to someone like you, because I'm not sure that everyone in my orbit is adhering to their prescriptions. All right, still some technical issues. That happens. Thank you very much, Cassandra Ford. For more information on the Beverly Clinic, we have a link on our website, KETK.com. Medication adherence is the topic, and hopefully we can get her back on to talk about this important topic.